Kenny, when you first came in, you came in and you have an upper partial denture.
Yeah.
And you talked to me a little bit about that partial denture, and what were some of the things that you were concerned about or you didn't like about the partial?
Didn't fit proper.
Yeah.
As far as I was concerned, talking was I spit when I talked because the partial on the roof of my mouth, my tongue would always hit it.
Yeah.
Couldn't smile well because I didn't feel confident in it. I just didn't feel right. When I chew, it would move on me.
Yeah. So tell me about, you said you had a story that when you were at a function or you were someplace and you needed to eat, what would you do?
I would actually pull it out because I'd move to another place, get away from everybody and take it out so I could chew proper and eat.
And eat. When you came here, your first intention, you told me you just kind of wanted an implant on the front tooth.
It's the front tooth, yeah. That's exactly what I wanted. Just individual implants. But as you explained to me that in the long run, because the rest of my teeth not loosen and they're gonna fall out eventually, that it's probably better and cheaper in the long run to get the whole thing done.
When you were starting to think about having this done, what are some of the concerns you had? Obviously, the financial part of it was a concern.
That was a big concern,
Yeah.
The financial part, not so much getting it done. It's something I wanted my teeth in. I wanted them looking good. I wanted to be able to smile, not having to go into. My wife always said I wouldn't eat when people came over. I'd go into the other room.
Right.
I wouldn't go out for dinner.
Right. So even when you're talking to me now, you're kind of, with your upper lip, you're kind of
blocking it.
Yeah.
I can feel it.
Yeah.
I do block my my teeth.
All right. Talk to me now without the partial. So this is how you would. This is how you came in this morning. You didn't even have the partial in. Right. And you're kind of just hiding with your lip because you feel self-conscious about missing those teeth.
Right.
And then tell me about your visit with Dr. Koo. You had your consultation visit with him.
Yep.
What about him or about us made you confident in us doing the treatment?
Very professional. Very. You explain everything very well. Very confident in the work that you guys do. Dr. Koo was very great in telling me exactly how, explaining how, you the same way. It was. I feel comfortable. I'll be honest with you.
So Ken, I want to thank you for going and following through with the treatment here. I know that was a really big decision for you to make. So when we started this, you had mentioned a few things that you were concerned about with the way that your teeth were at the time.
Yes, I wouldn't go out to eat. People would come over. I would go in the other room. And originally I came here for just 3 or 4 implants. And I'd go in the other room to eat, because I wanted to take them out. It was more comfortable for me.
Right.
And then I came here because we had to do something. And you told me that you could do a few implants, but the teeth around it were loose. Yes, very loose. And in time, they would eventually get bad too.
Right. The planning process we showed you how we did it all digitally. Was that easier to understand? Was it the same or not really make much of a difference?
No, it was very easy to understand. Plus, the way you explained it to me. You put everything in layman's terms.
Right. I appreciate that. So tell me about the day that you had the teeth extracted and you had the implants placed. I think it was a Friday. Thursday or Friday. And were you feeling pretty okay over the weekend and by Monday?
Yeah, I felt fine. I got a little puffy in the cheeks. No pain whatsoever. Just felt a little different.
Right.
But that's about it.
Not too bad.
Yeah.
And then you wore that temporary for about 4 months or so. And then just recently we went into the final prosthesis, so the final implant-supported denture.
Yeah.
And a little bit of difference going from that one to this one, right? Because that was a little bit bulkier.
Yes, exactly. It was different for the 4 and 5 months. Different, not in a bad way.
Right.
But this is 100% better.
So tell me a little bit about now. Do you avoid any foods if you got to the point?
Absolutely not.
No.
We go out to dinner, my wife and I, and we enjoy ourselves. And I take a picture. I got a big smile.
All right, good. So happy with everything.
Very happy.
All right. Okay. would you say it's a little bit life changing for you?
Very much so.
Okay, all right, okay. Well, we
I
appreciate
did the right thing. You did the right thing.
We're happy to hear that. We're happy